One of the biggest barriers older adults face at the doctor's office is fear of hearing bad news. Many seniors avoid sharing certain symptoms or skip follow-up questions because they worry the doctor will confirm something serious, like cancer, dementia, or heart disease. While this reaction is natural, staying silent or avoiding the truth often causes far more harm than good. The reality is that early detection almost always leads to better outcomes. A suspicious lump, unexplained weight loss, or persistent shortness of breath may sound frightening, but bringing it up immediately gives doctors the chance to investigate while treatment is still manageable. When seniors hold back out of fear, they may only seek help when the condition has advanced, limiting options and making recovery harder. In other words, silence doesn't protect, it increases risk. Fear of bad news also robs older adults of peace of mind. Many spend months or even years worrying privately about a symptom that may turn out to be minor or easily treated. For example, memory problems might be caused by medication side effects, and chest discomfort might be acid reflux rather than heart disease. By not speaking up, seniors prolong their anxiety and prevent themselves from getting reassuring answers or timely solutions. Another reason fear is so damaging is that it prevents honest communication between doctor and patient. A strong partnership requires openness. If a senior hides symptoms or avoids questions, the doctor cannot provide complete care. This can lead to inappropriate treatments, missed diagnoses, or worsening health, all because the patient was afraid to know the truth. Overcoming this fear starts with reframing the way we think about medical care. Doctors are not there to deliver bad news, they are there to help, guide, and support. Even if the diagnosis is serious, modern medicine offers treatments, therapies, and lifestyle adjustments that can significantly improve quality of life. Knowing the truth gives seniors the power to make choices, prepare, and take control of their future, instead of leaving everything to chance. Instead of letting fear silence them, seniors should view every symptom as a piece of valuable information. Speaking up ensures they receive proper care, timely treatment, and the best chance of living longer, healthier, and more confidently. In the end, facing the truth is not frightening, it's empowering. Many older adults feel embarrassed or fearful about discussing memory lapses, confusion, sadness, or mood swings with their doctor. They often stay silent, assuming it's just old age or worrying they'll be labeled with dementia or depression. Some even hide these changes to avoid causing concern in their families. Unfortunately, ignoring or downplaying mental and emotional health issues can prevent early detection of serious conditions and rob seniors of valuable treatment opportunities. Memory changes are not always signs of dementia. They can result from medication side effects, vitamin deficiencies, thyroid issues, poor sleep, or even stress. All of these are treatable if caught early. However, if a senior never mentions their struggles, doctors may miss important clues. By the time memory loss or confusion becomes severe, options for treatment or slowing progression may be limited. Speaking up at the first signs, like forgetting appointments, misplacing items, or repeating questions, can make a huge difference in preserving independence. Mood changes are just as important. Feelings of sadness, hopelessness, or irritability are often brushed aside as normal aging or loneliness. In reality, they may be signs of depression, anxiety, or other conditions that can be managed with counseling, medication, or lifestyle adjustments. Left untreated, these emotional struggles can lead to withdrawal from friends and family, poor appetite, sleep problems, and a faster decline in overall health. Another reason seniors stay silent is fear of being judged, fear of losing independence, or fear of being told they can no longer live alone. But silence only creates more risk. Doctors are trained to help, not to take away independence unnecessarily. By sharing openly, seniors give their doctors the chance to identify treatable causes, provide support, and connect them with resources that improve quality of life. The best approach is to describe changes clearly. For example, saying "I've been forgetting names more often," or "I don't enjoy hobbies I used to love," gives doctors important information. Bringing a trusted family member to the appointment can also help, since loved ones often notice memory or mood shifts before the senior does. Staying silent about memory or mood changes may feel like self-protection, but it can actually speed up decline. By speaking openly, older adults protect their mental health, strengthen their relationships, and give themselves the best chance at staying independent and engaged in life. A dangerous habit among many seniors is brushing off medical advice with the phrase, "I'll be fine without treatment." Sometimes this comes from fear of side effects, sometimes from financial worries, and often from a desire to appear strong and independent. While it may sound harmless, refusing or delaying treatment can lead to serious health consequences and even shorten life expectancy. The truth is, most medical recommendations are made because ignoring a condition carries greater risks than addressing it. For example, refusing blood pressure medication can increase the risk of stroke or heart attack. Ignoring physical therapy might worsen mobility issues, leading to falls or loss of independence. Skipping diabetes treatment can quietly damage the kidneys, eyes, and nerves over time. When seniors insist they'll be fine, they may actually be putting themselves in danger without realizing it. Another problem is that untreated issues rarely disappear on their own. Minor discomfort today can become a major emergency tomorrow. A small skin infection could spread, untreated chest pain might signal heart disease, and ignoring dizziness could result in a dangerous fall. Medical care is designed to intervene early, before problems grow severe. By refusing treatment, seniors miss this critical window and often end up requiring more complex, costly, and painful interventions later. It's also important to understand that treatment doesn't always mean aggressive procedures. Many seniors fear surgery, long hospital stays, or strong medications, so they reject treatment altogether. But in reality, doctors often offer gentler options such as lifestyle changes, physical therapy, or mild medications to manage conditions effectively. By keeping an open mind and asking for alternatives, seniors can find treatments that suit their comfort level without completely ignoring the problem. Financial concerns are another reason some seniors say, "I'll be fine without it." However, skipping treatment often leads to more expensive emergencies later. Preventive care, regular checkups, and manageable treatments are far less costly than hospital stays or advanced disease management. Talking openly with the doctor about costs can lead to finding affordable solutions rather than avoiding care altogether. Instead of dismissing treatment, seniors should approach their doctors with questions: "What happens if I don't take this medication?" or "Are there safer, less invasive options for me?" This keeps communication honest and ensures that every decision is informed rather than based on fear or avoidance. By letting go of the phrase, "I'll be fine without treatment," older adults empower themselves to make smarter health choices, prevent complications, and maintain a higher quality of life well into their later years. Many older adults, especially those who dislike making a fuss, often nod in agreement with whatever their doctor says, even if they don't fully understand, have doubts, or still feel unwell. They may say yes, that's fine, just to finish the visit quickly. While this might seem polite or convenient, it can be a serious mistake that harms long-term health. Doctors are responsible for guiding treatment, but healthcare works best when it's a partnership. If a senior agrees to a plan they don't understand or doesn't ask follow-up questions, the doctor might assume everything is clear. As a result, important details about medication, lifestyle changes, or test results may never get clarified. This can cause confusion at home, leading to missed doses, incorrect treatment, or unnecessary suffering. Another problem with automatic agreement is that it hides true feelings. For example, a doctor may suggest physical therapy for knee pain. If the patient secretly feels it's too painful, too expensive, or difficult to manage, but nods along anyway, they may simply skip the therapy later. This not only wastes time and resources but also prevents recovery. Worse, the doctor may wrongly assume the treatment didn't work, when in reality it was never followed through. Seniors sometimes rush through appointments because they don't want to burden the doctor or feel guilty about taking too much time. But doctors expect patients to ask questions and share concerns. A clear conversation ensures that the care plan matches the patient's needs, lifestyle, and comfort level. Without honesty, the treatment is often incomplete or ineffective. Instead of agreeing too quickly, seniors should practice speaking up when something isn't clear. Asking questions like, "Can you explain that in simpler terms?" or "What are the side effects of this medication?" is not only acceptable but necessary. If the doctor recommends a treatment that feels overwhelming, it's better to say, "I'm not sure I can manage this, are there alternatives?" than to quietly agree. At the end of every visit, seniors can use a simple strategy: repeat the instructions back in their own words. For example, "So I take this pill once a day with food, correct?" This ensures both patient and doctor are on the same page. By avoiding the habit of agreeing just to leave quickly, older adults can build stronger communication with their doctors, receive safer and more effective care, and feel more confident in managing their health. One of the most common, and risky, mistakes older adults make at the doctor's office is failing to mention all the medications, vitamins, or herbal supplements they are taking. Sometimes seniors forget to bring a list, while other times they think certain over-the-counter pills or natural remedies don't count. But hiding or overlooking this information can create dangerous drug interactions, reduce treatment effectiveness, or even cause life-threatening side effects. As people age, they are often prescribed multiple medications for conditions such as high blood pressure, diabetes, arthritis, or heart problems. At the same time, many also take supplements like fish oil, ginseng, or herbal teas for energy, sleep, or memory. While these may seem harmless, they can interact negatively with prescribed drugs. For example, St. John's wort can interfere with antidepressants, and even common supplements like garlic or ginkgo can thin the blood and raise bleeding risks when combined with blood pressure or heart medications. If a doctor doesn't know about these, they can unknowingly prescribe something that causes harm. Another issue is dosage mistakes. Seniors who don't mention extra pain relievers, sleep aids, or duplicate prescriptions from different specialists might accidentally take too much of the same drug. This can lead to dizziness, falls, confusion, or organ damage. Many hospitalizations among older adults come from drug-related complications that could have been avoided with better communication. Doctors can only provide safe and effective treatment if they have the full picture. If a patient hides or forgets to mention supplements, the doctor might misinterpret new symptoms as a disease rather than a side effect of medication. For example, fatigue or memory issues may not be a sign of aging, but the result of mixing medications. Without honest disclosure, these connections are easily missed. The best solution is simple: always keep an updated list of every medication, supplement, and vitamin being taken. Bring this list to every appointment and update it whenever something changes. Seniors should also include details like dosage and frequency. If unsure whether something counts, it's better to mention it than to leave it out. Doctors are not there to judge but to protect health. By being open and transparent, seniors can avoid dangerous mistakes, ensure treatments work properly, and gain peace of mind knowing their care plan is safe and personalized. Many older adults have a habit of saying, "I don't want to bother you," or "I'm sorry for wasting your time" during doctor visits. This may come from growing up in a generation that valued toughness and not complaining, or from believing doctors are too busy to handle small problems. While this attitude might seem polite, it can be dangerous. It often causes seniors to hold back important details or avoid asking questions that could improve their health and well-being. Doctors expect patients to share what they're experiencing. Their role is to listen, investigate, and provide care, no matter how minor the issue may seem. When seniors apologize for taking up time, they may unintentionally cut their appointments short or skip over symptoms they think are not worth mentioning. This can result in missed diagnoses. For example, a mild cough might be dismissed, but if left unchecked, it could signal a lung issue. A slight stomach ache could turn out to be something more serious, but if it's brushed aside, the opportunity for early treatment is lost. Another problem is that apologizing puts the patient in a passive position. Instead of being an active partner in their healthcare, the senior may give the impression that their needs are less important. This can weaken communication and even lead doctors to overlook the urgency of their concerns. Seniors must remember, their health is just as important as anyone else's, and they deserve full attention without guilt. Apologizing can also silence important questions. Many elderly patients walk out of the clinic still confused about medications, side effects, or test results because they didn't want to waste more time. But unanswered questions often cause more harm, leading to medication errors, unnecessary anxiety, or failure to follow medical advice properly. The truth is, no doctor sees a patient's concerns as a waste of time. Medical professionals would much rather hear about symptoms early than deal with a serious emergency later. Seniors should reframe their mindset. Speaking up and asking questions is not an inconvenience, it's essential for staying healthy. Instead of apologizing, seniors can confidently say, "I have some concerns I'd like to discuss," or "I need help understanding my medication." Clear and direct communication ensures doctors have the full picture and gives patients the confidence to advocate for their own care. One of the biggest mistakes older adults make at the doctor's office is downplaying their pain or symptoms. Many seniors tell their physician, "It's not that bad," or "I can live with it," even when the discomfort affects their daily life. This habit may come from wanting to appear strong, not wanting to complain, or thinking the doctor has more important patients. Unfortunately, minimizing symptoms can prevent doctors from understanding the real seriousness of the issue. Pain is the body's way of signaling that something is wrong. Whether it's chest tightness, persistent headaches, dizziness, or joint pain, these warning signs should never be brushed aside. When seniors downplay pain, doctors may assume it's mild and not worth investigating deeply. As a result, conditions like heart disease, diabetes, infections, or even cancers can remain hidden until they progress into more dangerous stages. What might have been treated easily at the start could turn into a crisis simply because the patient underreported their discomfort. Another risk is that untreated pain can dramatically reduce quality of life. For example, older adults with chronic knee or back pain might begin avoiding walks, exercise, or social activities. This can lead to muscle weakness, weight gain, loneliness, and even depression. By not being upfront about the level of pain, seniors unknowingly limit their own independence and long-term health. Doctors are trained to evaluate symptoms and determine whether further tests or treatments are necessary, but they can only work with the information given to them. If a patient says, "It's nothing serious," when in reality the pain wakes them up at night or prevents them from cooking, the doctor might underestimate the situation. Being specific about frequency, severity, and impact on daily life gives the doctor a much clearer picture. Instead of minimizing, seniors should practice describing pain in simple but honest terms. Using a pain scale, for example, 7 out of 10, or describing how it interrupts daily tasks is very effective. Saying something like, "My hip pain keeps me from climbing stairs," or "The headaches are so strong I can't read for long," helps doctors connect the symptom with real-life consequences. Downplaying health issues might feel polite, but it's actually dangerous. Seniors should never hesitate to fully express what they're experiencing. Honest reporting ensures accurate diagnosis, better treatment options, and a greater chance of living with less pain and more freedom. One of the most common and harmful phrases older adults use at the doctor's office is, "It's just part of getting old." While aging naturally brings changes to the body, dismissing health problems under the excuse of age can lead to serious consequences. Many conditions that seniors assume are normal aging are actually warning signs of treatable illnesses. For example, persistent fatigue might point to anemia or heart disease, ongoing joint pain could signal arthritis that can be managed, and frequent forgetfulness may be an early sign of dementia rather than just old age. When seniors brush off symptoms, doctors may also take them less seriously. If a patient insists that pain, weakness, or sleep issues are normal for their age, a busy physician may overlook the possibility of deeper medical problems. This not only delays proper diagnosis but also reduces the chances of effective treatment. Small health issues left unchecked can quickly grow into major complications. Another risk of saying this phrase is that it discourages open communication. Doctors rely on accurate descriptions of symptoms to provide the right care. If an elderly patient dismisses discomfort or struggles as part of the package, they're essentially hiding valuable information. This can result in missed opportunities for relief, better mobility, or even life-saving intervention. It's important for seniors to remember that aging does not mean surrendering to pain, weakness, or poor health. Medical science has advanced to the point where many age-related conditions can be slowed, managed, or even reversed with proper care. Saying it's just part of getting old robs you of these opportunities. Instead, older adults should practice being specific and honest with their doctor. Rather than dismissing a problem, describe when it started, how it feels, and how it affects daily life. For example, I've noticed more shortness of breath when I walk to the mailbox, or my hands hurt so much in the morning that I struggle to make breakfast. This gives doctors clear clues and allows them to recommend meaningful solutions. In short, aging does not mean you must accept unnecessary suffering. By avoiding this damaging phrase, seniors can open the door to better care, improved quality of life, and the chance to stay active and independent for many more years.